Chronic respiratory diseases are the third leading cause of death worldwide, responsible for over 4 million deaths per year. And it's believed that over 550 million people worldwide suffer from chronic respiratory diseases. And these have a huge impact on both physical and psychological health. Now, we often concentrate on the physical symptoms, but what is the impact of having chronic respiratory disease on mental health? And what should physicians take into account? We investigate. This is EUFOREA News, broadcasting from London. Hello and welcome to EUFOREA News. I'm Dr. David Bull. Chronic respiratory diseases affecting the airways and other structures of the lung are amongst the leading causes of morbidity and mortality worldwide. Some of the most common chronic respiratory diseases are asthma, COPD, and chronic sinus disease. And there is no doubt that chronic respiratory diseases are associated with a major impact on the well-being and mental health of affected individuals. Anxiety and depression are common and important comorbidities in patients with CRD. And the pathophysiology of these psychological comorbidities is complex and possibly explained by common risk factors, response to symptomatology, and biochemical alterations. The presence of anxiety and/or depression in CRD patients is associated with increased mortality, exacerbation rates, length of hospital stay, and decreased quality of life and functional status. Now, there is currently no consensus on the most appropriate approach to screening and treatment of the mental health aspects of CRD. Well, here to explain more is Professor Andreas von Leopold. He is Professor Health Psychologist at the research group Health Psychology, Faculty of Psychology and Educational Sciences at the Catholic University of Leuven in Belgium. Thank you very much indeed for joining me. Perhaps I may start by asking you, why do you think the mental health burden of chronic respiratory diseases is so often neglected?
Well, I think this has several reasons at different levels of the healthcare system, at the side of the patients, at the side of the caregivers, and also at the side of the full healthcare systems. On the side of the patient, it's often observed that they have a missing knowledge about what are mental disorders at all, and they often also have no information about where to go if they perceive such mental health issues. At the same time, they also may feel some shame or some perceived stigma to openly discuss mental health issues. On the side of the medical caregivers, there's also very often missing knowledge about the importance of mental health burden in respiratory diseases, and also missing knowledge or training about these symptoms, how to measure them, how to detect them, and how to treat them. Finally, also in the primary care sector, we often hear from clinicians that they report that they simply do not have enough time to discuss mental health issues with their patients. And finally, there's also often missing information and or difficulties to refer affected patients to the right mental health services. Finally, on the side of the healthcare system, there's still a lack of routine screening protocols for mental disorders. There's insufficient implementation and organization of psychological care for these patients, and often very low financial support or reimbursement options for patients in healthcare systems.
So you've rather beautifully described how complex and multifactorial that is. So trying to put some of that into practice, what are some concrete steps that healthcare providers can take to try to address the mental health of their patients?
Well, I think at first it's important to inform the patient and also the caregiving family members about mental diseases and mental health. This can be by leaflets in the waiting room. This can be in consultations. Then, of course, they have to know the symptoms and signs themselves. Then it would be very helpful to also perform screening for psychological distress regularly in their patient. That can be with simple questions during consultations or by using screening instruments and questionnaires. And if they detect mental distress, mental health disorders in their patients, they may consider to refer them to healthcare specialists or refer them to multidisciplinary pulmonary rehabilitation programs.
We're seeing more and more the link between the mental health of patients and how well they do physically. So in your experience, does addressing the mental health burden of chronic respiratory disease actually improve patient outcomes? One would imagine the answer to that would be yes.
Absolutely, yes. There is a lot of evidence showing that addressing these issues has beneficial effects. We know, for example, that cognitive behavioral therapy programs can reduce depression rates, anxiety rates. They can improve health-related quality of life and exercise capacity sometimes as well. We know the same from interdisciplinary pulmonary rehab programs that do not only improve exercise capacity, symptoms, quality of life, but they can also powerfully reduce anxiety and depression. And we also have some evidence that self-management interventions or some relaxation techniques can improve levels of anxiety and depression.
And do you think, finally, if I can ask you, are we getting better at dealing with the mental health burden of these types of diseases?
I think we are raising the awareness over the past years, step by step, doing a respective workshop, talks, presentations on conferences. However, there's still much more work needed, both on the side of research, so which intervention to reduce psychological burden is effective for which kind of patient, in which doses. But we also need to do much more to implement these treatments and also screening for mental disorders in the routine clinical care.
And it's just so important. So thank you so much for your time. That's Professor Andreas von Leopold.
Thank you.
Well, let's now look at this from the patient perspective. Joining me now is Mrs. Csaba Csota. She is a dedicated member of the French Patient Advisory Board of EUFOREA and French patient advocacy group anosmi.org. She was also then appointed as an ambassador of the patient community in 2023. Actively engaged in patient advisory boards, she advocates for individuals affected by anosmia, contributing her expertise to raise awareness and support within the community. And Csaba herself is affected by anosmia due to CRS-WNP. Really good to talk to you. Can we start by just explaining to us your story, how your mental health relates to your respiratory disease?
So when I was diagnosed with CRS-WNP, to start with, I had no idea that it would last for so long, because I didn't realize that it was a chronic disease that would actually impact me for the rest of my life. So this I had absolutely no idea. Anosmia, from the very beginning, I saw the impact on my life, because not being able to smell is impacting your life day by day, right? I mean, not being able to smell your kids, not being able to smell yourself is really difficult. Again, people can't imagine how difficult it is. The fact that you cook and you can't even taste what you're cooking, so you lose, all this joy of preparing food for your family, again, going out to the restaurants and enjoying social life, but also the danger that goes with it, right? You don't know what you're, sometimes if something is, not good anymore, food is not good and you can't smell it. Or it happened to me that I was cooking and I forgot something, and, I was not alerted by the smell of something burning. So eventually, having to go through this every day, and also I think not really seeing an end to it can lead to some sort of depression, I think. Like not being able to see hope that one day, life will be like in the past. I like this expression that I for me, describing living with CRSW and P, and therefore without the sense of smell, is like living in black and white. You don't enjoy everything. You only enjoy part of your life, and therefore, again, I mean, I had moment in my life where I was just, like so tired of it that I would just, start crying, because it does affect your positivity, your way of also planning things, right? Like going on holidays, completely different. I went to places where I went when I was a kid, and everything is associated. Smell is associated to memories as well. So going back to a place where you associated some odors to the place, you can't experience that anymore. And it has an effect on your mental health, definitely.
Can I think you've explained beautifully there the profound impact on your mental health. Do you think your mental health was ever taken seriously by the medical profession?
Again, I think that it's the burden is under-recognized, underestimated overall, but probably even more by doctors in general. I think that they don't really recognize. A lot of people around you would just go, like comment, oh, oh, you're lucky you don't smell, like bad things, right? But it's not the case, right? I mean, it's there's nothing great in this. But I think that when you go to doctors and they underestimate what you're going through, is really difficult, right? Because as a patient, having someone listening to you, recognizing that what you're going through is difficult, that it can affect your quality of life, is already something very important. I think it does help people if somehow what they have to go through is being recognized.
And just in terms of that, when you went back to the doctor, and I completely understand it sort of pervades every aspect of your life, as you say, it never goes away. Did the doctors take that seriously? If you said, I'm depressed, did they put you on medication? What sort of intervention did they give?
So the options for me was to go through surgery, which I had done once, but did not really have an impact because I did not recover smell and I continued having asthma. So the alternative was to get to use biologics, and actually, funnily enough, the NT that I saw, so that it would be better for me to go through another surgery. But I refused it, and actually I cried. I was so desperate when I was with my ENT. I was so desperate about hearing the fact that I had to go through a surgery, which was not even a success the first time I did it. I just, I had a nervous breakdown, and I said, no, I don't want to go through that again. And if there's another option for me, then, why not? And I think that he only then, when I cried in front of him, he realized that I was really desperate, and then he decided that I could use the biologics, the biotherapy.
So what recommendations would you give to physicians who are treating CRD who haven't woken up to this, who haven't seen stories like yours or understood what it's like for a patient like you to go through this mental torture?
My recommendation would definitely be to listen to their patients, because I think this is something that is not done enough. Just, hear them. and recognize what they're going through, because again, it's really something very painful. So yeah, that would be really my recommendation, and also to look at what are the different options, right? And actually try and give the best option that will suit the person, but also, yes, to keep themselves aware of what is available as options for people who do suffer from this disease. I think that would be my main recommendation.
Well, thank you so much for speaking so candidly. I really am very grateful indeed. Many thanks to Mrs. Chapa-Joda.
Thank you.
Well, a really fascinating insight into the impact of chronic respiratory diseases and mental health. And that's it for this EUFOREA News Show. Many thanks to my guests, to Professor Andreas von Leopold and also Mrs. Chapa-Joda. Now, you can find more information about EUFOREA and register for the EUFOREA educational events on the euphorea.eu website, where you can also sign up to receive the latest news via email. And don't forget to follow us on social media, on YouTube, Twitter, LinkedIn, Instagram, Spotify and Facebook. Until next time, goodbye.